Or people are representing themselves as being a nurse and they're not. People are representing themselves as being a licensed psychiatrist and they're not. Right? People representing themselves as having 22 different designations on the back of their titles and they have none. There's a lot of really sketchy stuff that's happening in this place. Like this guy, there's a lot of not allegations. I mean, it seems well documented. This guy's intoxicated a lot of the time, right? I mean, this guy is doing substances. I mean, they've got videos of the guy, dancing in the hot tub, right? I mean, it's like, well, people are inside that are going through detoxes,
You're just getting a seat.
The problem is,
it's because you don't have the dog. Is that why? It's because I have the dog. Is that why I'm more comfortable than you are?
That must be it. Yeah. Well, it's now there's so many. I put the chairs on wheels, right? So it's got so many variables.
So if you had no choice, it'd be fine.
I would not be thinking about it for one bit because they are completely unmovable.
I was watching some of the older videos we did.
Yeah.
Like all the different angles that you'd chosen and stuff like that. And I remember the first one we did where it was in the other room with I don't know, it was like there was like a table in the middle or something, and you had like two
dining room chairs going on, both cameras staring at each other.
Yeah. The quality is a whole other level these days.
Yeah.
We've got to figure out how to make the
content go up with the video.
Well, our content. I think when you've brought in like other sort of videos and reactions, and when you've done those well produced ones that are like 5 minutes or 10 minutes long, those seem to be really well received. People get really pulled to them. With those shots. There's something about like my long form conversation that is not as interesting as it hasn't caught on.
So there's a story that is in our market this week. The Toronto Star did a couple-part expose on this organization, and they kind of did some. There are some questionable allegations. None of this has been proven in court, but the Star does a pretty deep dive on stuff, and they seem to have a lot of references to it. So I thought it would be interesting to sort of cover that. I guess a couple top level things. I mean, first off, it's kind of a theme that we've had around here is that the more you pay doesn't mean the more you get in terms of value of care. Is that a fair point?
Yeah, no, I think we did this. So we went through the audiobook of Matthew Perry a while back, and then we talked again after or when he passed away. And his story is full of times he was getting treatment, or what you would call treatment, and it didn't seem to meet the standard of care that you or I would expect, from a program with regulated healthcare professionals.
Right.
And it seemed almost like this thing where it's almost like the more you pay, the harder it is to be held accountable. Sometimes you get physicians prescribing things that other physicians may not think is indicated, or guidelines may not think is indicated.
Right.
I mean, even with Matthew Perry, there was one page in his story where he literally wanted some opiate or something. I can't remember what drug. The doctor in California was like, no chance. He paid $100K, flew down in his private jet all the way down to, I don't know if it was Switzerland or wherever, and stayed there and then got whatever the meds that he wanted or needed, and it's one of the things where like, I don't know. I don't know if short-term patient satisfaction is the best outcome measure for people, who are going through healthcare, addiction healthcare, substance use health.
Sure. I mean, and that's a great point, right? I mean, if the substance users got everything, if they could control everything all on their own and get everything if getting everything they wanted worked for them, they probably wouldn't need treatment, right?
Because, I think in the Matthew Perry case, that's what it seemed like. And when I was going through the book, it was just there was a few examples of the type of care he had there, and in Ontario, I mean. Usually what we have people do if they want some kind of a treatment program, we find some generic phone number to call or some like government funded program, and they have a whole list of the private and the government covered facilities. They have estimates around the wait times, some ideas around the services that are being offered, but it is something where if you have 30, 40, whatever K, you can go the next day to it. And I did not know before you sent me the Star article that some of these places are regulated and certified, and some of these ones aren't.
Yeah.
You know, I'll do one side story before I'll let you guide the conversation. You can cut this out if needed. So, for things that are within the government, right? Like things that are government run in hospitals and so forth. There was a period of time where the Ontario government was running all of these detoxes all around the province.
Yeah.
Detoxes, people go to detox from all drugs, but probably was the most common is probably alcohol. And alcohol is a medical emergency. And these facilities had no medical healthcare providers there for decades. I think it changed maybe around 2015, 2019, 2020. But there was a period of time where you almost couldn't expect the government-run facility to properly treat someone's withdrawal. You had to rely on the emergency departments. That's one. And then number two, even within the hospital, there was a few times where I had a different idea of management plans, right, for certain patients that I was seeing. And I would call, we have this CMPA that'll guide us, right, around medical legal stuff and all that stuff. And I was like, well, this is, what I'm recommending. This is what's being done. And this is the care this is like a long time ago. And they were pretty much saying that, for the medical profession, you're judged based on what the active standard of care is, like say around the province or around the country. And I was trying to explain to them that, well, you could have the same patient that comes in for hospitals, completely different approaches.
Yep.
You could come in with a severe alcohol withdrawal, have a seizure. Someone sends you home with 20 tablets of 10 of Valium. Or you could have somebody who has a seizure, they leave with 1 or 2 tablets of Valium or they leave with none. And this is just different places around the province and country. And you could have times where you're worried about the seizure risk, but somebody discharges somebody, or you're not worried, or they keep them, and basically from the response, because there was no solid standards at that time for hospital-based addiction care or substance use care, it's hard to get anyone in trouble for anything, and this is within regulated healthcare professions. And so I just I don't know where this conversation is going to go, and there's something just unsettling about people saving up a lot of money and putting that money to recover from addiction when I hear about what they're doing or getting, sometimes it doesn't feel like the basic standard of care.
Yeah, I mean, there are so many different models out there, right? So I think back to my first, actually, probably my only conversation about addiction with a healthcare provider about my own addiction, okay? This was probably going back almost 20, maybe, I don't know, let's say 17, 18 years ago. And I don't talk about this very often. In fact, I don't think I've ever talked about it. I had a psychiatrist that I saw on a regular basis with just supporting my ADHD. And I developed an addiction to ketamine.
Okay.
Right? And this was, one of my addictions over the years. And I just decided to tell my psychiatrist about it. And he said, "No problem. I got a guy." And okay, it's like, "I got a guy for you. He's we'll call him Bob. I literally don't remember his name. Could have been Bob. He looked like a Bob. And he's going to stay with you. He's going to live with you, and he's going to be your shadow for the next 7 days, 24 hours a day. He's going to come to your house. He's going to live with you." And he just totally took control of the whole thing. Right? It wasn't really an option. I mean, we had a good relationship, right? And so I got Bob's going to come, and that was basically the introduction of what Bob was. Now, in hindsight, now that I've worked in this field for a decade, now it's sort of like, okay, Bob's a recovery coach, right?
Yeah.
And Bob lived with me. And, we did everything together. He came to my house. He came to work with me. And, he was just my friend. He hung out in the warehouse for a little while I was in the office. I mean, nobody knew where Bob was coming from, but Bob was a cool guy, right? So Bob was just around. And And it worked, right?
Yeah, and so the few cases of recovery coaches that I've heard were like, because sometimes in some places we've worked, usually have people that are on disability, ODSP.
Yeah.
Occasionally get people with means. The few recovery coaches I've heard where they actually pay the guy a certain amount an hour. The guy just sits with you for like a week or a month. It's actually highly. So I only heard about the stories that succeeded, right?
Well, that's true. Yeah.
Although I would imagine if it were to fail, you would have had to actively fight to get rid of Bob.
Well, that's
you'd
the
have
thing.
to like, Bob, like, I'll be back in a minute, and then you like walk out and you don't come back, right? Like or something like that. But I mean, this scenario I don't know much about. I don't know about these addiction recovery coaches. I don't know what their training is or certification.
I mean, the wheels could have fallen off that bus very easily too. Bob wasn't regulated. I was in a psychiatrist's office. The psychiatrist had nothing to do with addiction. He wasn't an addiction psychiatrist. He had no.
Oh, but he heard about these addiction recovery coaches and
connected. He used Bob before. Bob he had other patients. Everyone's got addiction, as we know.
Like, so you do need somewhere to send people if you're not going to be able to.
Right, and
I don't know what to do for ketamine's hard.
Ketamine is hard
to treat. There's not a great medication. Where are you going to send? I mean, the only thing where are you going to send somebody for regular counseling?
And I mean, I was at a point in Bob was making, I think it was like $30 or $40. I mean, Bob's making like $600 or $700 a day at this point, right? But as we're going to find out about Muskoka Recovery, $600-700 a day is a drop in the bucket, right? Because they're charging up to $2,000 and $3,000.
Oh, but they also have like living too, right?
Yeah,
like,
you get to stay in a bed there.
You stay in a bed.
But Bob has to.
You have to prepare somebody to work in their real world, right? You have to. You can't just like disappear and then get better. Then all of a sudden, life is interactional. But thank you for sharing about that recovery coach thing, because I haven't had many people I've worked with who've done that. The couple stories I have heard are successful. That at least while the person's there, you're using less. You know what I mean?
If a good recovery coach, he's on you. Like he is on you. Like he's like at the washroom with you. He's like, I mean, you got to really be like, I need some help, and you got to,
So I think I got to do some reading and learn about recovery coaches.
Right.
Like I really do, because I don't know much about the culture, the
right. And again, it's
industry.
So I don't think licensing or not licensing is really the key. I think it's about transparency, and I think when we talk about Muskoka Recovery, it is, I think Muskoka Recovery is a bit of an outlier in here. I've not heard universally where people are representing themselves as being a nurse and they're not. People are representing themselves as being a licensed psychiatrist and they're not, right? People representing themselves as having 22 different designations on the back of their titles and they have none. That's a rarity.
Yeah, I mean, I did read the article in the Star, but I don't remember the details around the misrepresentation. I do know that previously people were licensed and they weren't anymore.
Right, that in one case.
But I don't know if they were advertising that you'll see a licensed healthcare provider.
Doctor on site. They advertise.
They say doctor on site.
Doctor on site, and the doctor happens to be in Nova Scotia and not licensed to practice in the province.
Yeah,
I know you're always going to defend everything that says, but
doctors do. Yeah. It's getting hard.
That's a hard one to defend.
Hard.
Now, in fairness,
it's getting hard to defend what doctors do.
In fairness,
I try, but
we don't know what we're not aware of what was represented to the client, but I'm certain that a doctor knows where they're licensed and where they're not licensed to practice. So let's spread the blame out on that. But even there, so this place is full of medication. They got all kinds of medication. There's no prescriber on there to dispense that medication, right? This is a place that, people have died there. People die in recovery. It happens. But if someone's going to die in recovery and you're counting on the fact that there's this risk, you'd want that nurse to actually be a nurse that's putting an IV in you.
They were putting IVs in people?
Well, the person that passed away, they put the allegation, and it seems well documented by multiple sources, is that somebody was in extreme medical distress at 6 p.m. And they put an IV in her, and they ended up calling. They didn't call 911 until 3 a.m. for the person. There's a lot of really sketchy stuff that's happening in this place. Like this guy, there's a lot of not allegations. I mean, it seems well documented. This guy's intoxicated a lot of the time, right? I mean, this guy is doing substances. I mean, they've got videos of the guy, dancing in the hot tub, right? I mean, it's like, well, people are inside that are going through detoxes, going through active detoxes where there's supposed to be medical people on site 24 hours a day for when you're going through the detox. phase, which is required, right? That is needed in a detox. You need to have supervision in a detox, right? I've worked in a detox. You've worked in facilities that do detox, haven't you?
Yep.
Okay. And having somebody outside partying in a hot tub while somebody's in medical distress inside is problematic.
Yeah. I'm not going to argue with that. I mean, this is like...
if you say, well,
everything seems
doesn't everybody need a little bit of hot tub time?
Well, as a treatment place, it's highly inappropriate. But I mean, I don't know what to...
So here's
maybe this is the culture. Maybe this is the recovery culture. I don't know.
Well, does it sound like
it sounds like I would feel like, first of all, you have people that will do anything to help their loved one.
Right.
They'll take out loans. They'll take out this. They'll pay 30, 50K 3-4 times. And as a society, can we allow places to advertise themselves as like, this is what we do?
Right.
And not offer the basics of care.
Right.
And even places that like, it's one of the things where, in order to know what these black box treatment centers do, and it's the same thing with certain therapists. Well, I'm seeing a therapist. Well, what therapist, like,
what are they doing?
What do you do with them? Like, what's a session like?
Yeah.
What's a session like with them? And sometimes you're trying to figure, oh, no, I've talked about my trauma, I've talked about this. And you hear what they're doing in the sessions, and they've been doing it for 2-3 years. It's like supportive counseling. They go, they vent, they feel heard, they connect to the therapist, but they're not getting any kind of insight. They're not getting any kind of, like, I don't know how to explain it, but it's one of the things that, you almost have to ask the patient or the client, what was the experience like? What was the screening? What'd you go into? What did they offer? Was it helpful? Why was it helpful? Was it not? Then after all those questions, then you realize like what they did, what they got out of it, and was it helpful or not? And at the very least, most of these places, if you stay there, you'll get a certain number of days of sober time.
Yes.
Right? That's one thing. And so at the very least, I know people are getting things where all of a sudden they feel a little bit of the real world fully. They don't have the buffer of alcohol or cannabis or whatever drugs that are there. At least I know they have that. Sometimes you get lucky and they get an assessment. They get like a 1 or 2 hour psychiatric assessment. You could read it. Sometimes they'll offer certain medications.
Sure.
Sometimes they'll detox the person comfortably. Sometimes some of the groups might cover some of the skills, but it's hard to really, really know. But it takes me a long time to figure out what care did the person get for those 14, 21, 28, 45, 60, 90 days.
Sure. And so on that point, so if you go to Muskoka Recovery and they pick you up, sometimes people are flying in from across the country and they pick you up at the airport, right? And what would you think that they would do on the way from the airport? They bring you to the bar, right? And have a few drinks before you get there. So you could, maybe there's some you could argue there's some therapeutic benefit to that. I don't know.
Well, I mean, the therapeutic benefit would be if you've been drinking heavily, you're going to have some withdrawal symptoms. A couple of beers might like mitigate those things.
You're going to
maybe it builds a bond and relationship, and I get it. But I mean, I think the thing is that like it's. Yeah, I don't know. Like a lot of these things seem like wild and out there. It's hard to know what's true and what's real. And if this is the state of what's come out, imagine the stuff that we've not heard about, and that's very upsetting. It's very upsetting to imagine what other places are there, what are they doing, and what's happening to some of these vulnerable people.
Yeah, definitely. I mean, there doesn't seem to be any kind of structure to this at all. I mean, the one thing that the one thing we know about addiction, which was a sort of a meme we sent back and forth this week, which was what was it to the effect of if I
remember now. Alcohol is not the problem.
Right.
Alcohol is the solution to the problem.
Right.
And if you don't have another solution,
right, how
are you going to give up the alcohol?
Right. And along those same lines, I think I sent you a slide from one of the presentations that I did, is that, if addiction, if you have an addiction and, and it's an escape from a problem, if you remove the substances and the problem is still there, the addiction's going to recur.
Yeah, you want the sober life or whatever life to be so fun, exciting, rewarding that you wouldn't want to miss 1 second by being away with any substance. You want to be fully there, fully present, fully on.
So if you don't fix the underlying problem, it doesn't matter if you remove the substances, the substances will come back.
Yeah. I mean, there are cases that once you get 30, 45 days in one of these facilities, maybe part of it is learning the solution to some of those problems.
Well, that's the point. So part of it is learning. Exactly. So are these guys learning anything? They're not learning
I
anything?
don't know. I think we would probably have to hear from the success stories maybe a little bit, but I mean, I just think this is a huge problem, and everything.
I have a feeling people are going to crap on you in the comments, saying that this guy's defending everything about this place.
I don't know. I mean, it's either I have to assume that people have good intentions,
Yeah,
or that the world is full of these horrible manipulative people, and
I think both things can be true.
Yeah, I just think the idea, when I think about how low people are when they finally reach out for help, some of the people that I've seen, it sickens me to think that they would end up in a facility where they're treated like this and approached like this. It's a very uncomfortable feeling, and I have to look at the world in a way where people are trying their best. And
Do you think everyone was trying their best for Matthew Perry?
They may have been trying their best for themselves, but definitely not for Matthew Perry. And the thing is, when somebody has unlimited means, it's very hard to help them, because they don't have to come back to you. They don't have to see you. I still remember one case that I saw with someone. It was a colleague from another hospital was working with someone. He had the guy come and see me once. He came the other time. I don't know, so I was literally there with this all-star psychiatrist and this patient, and I'm just hearing the person's story. And once it became clear that the person had so much money, he had so many ways of hiding the drug purchases and the use, and nobody had a clue. I'm like, how am I going to get this guy to shift? Because he's found this way where the consequences are hidden from all those people he loves. Yeah. And I just like, when you have unlimited means, how do you help that person get help?
Yeah.
It's I don't know. And so I think, like, with Perry, one thing that came very clear going through it, someone was going to try to help him, and that person would end up providing something that may or may not be in his best interest in the long run.
Yeah.
And, it may be under the lens of best medical care, maybe under the lens of harm reduction. It may be like, oh, it's better he's getting this from me than from somebody else. And I think, like, sometimes with healthcare providers, when you start seeing celebrities, there's this thing where you feel like you're the savior, you're the one that can help, you're the one that understands.
Yeah.
And then all of a sudden you end up in areas that you would never have imagined.
Yeah.
You wouldn't. I think yeah.
I think you just touched on a really important point of, like, and this ties into a lot of things happening in our country right now, which is and perhaps elsewhere too, about involuntary care. I think there's some talk of this in the States as well. Now, this is there's a piece put out by I think it was is it Marshall Smith, who's the architect of the Alberta model.
I actually don't know the name of who the architect of the model is.
Okay, he's an Alberta guy who.
I felt like it was a team effort, whatever they're doing in Alberta.
I'm pretty sure he calls himself the architect, but I'm sure there's lots of people there too.
Like, that sort of tells you right there, right? I am the architect of recovery. Like, I'm pretty sure, like, they're taking from principles from recovery capital, recovery whatever.
Anyway,
okay.
The point of it was, and he listed out the myths. I think it's him. By the way, I'll put a little disclaimer if it wasn't him in this. I'll find it. Is that you don't need to have willpower. You don't need to want to stop addiction to get better. Now, if you read between the lines of that, that's the underlying thing of, well, we need to wait till somebody wants to get better. And that would be an argument for involuntary care. All you need to do is removing the substance from the person is enough to get recovery. Now, that's a pretty controversial perspective from our lens, right?
So I'll let you finish first.
Yeah. So, well, no, I mean, but if you can speak to that and what that, like, for us, we say, well, Jesus, I mean, that's...
So I was smiling, right? Because I try to teach people, like, normally you like, oh, you have to wait till you hit rock bottom. I don't think you have to hit rock bottom.
I don't think so either, yeah.
But I think, as a healthcare provider, you can create an environment where it's more likely for the person to seek care. Right? Like, so I'm not thinking, like, when I say you don't have to rock bottom, I'm not thinking, don't worry, I'll lock you up, I'll take away your drugs, and then you'll get better. And I think, like, I think for this whole Alberta thing and forced treatment, I think we have to wait a little bit to see how it's rolled out.
Yes, and I'm not really speaking about the Alberta. I'm just speaking. The philosophy was put out is that one of the myths of addiction is that you don't need to want to stop to have value in treatment. By the way, I don't believe that is.
Well, we both agree with that, though.
Yeah, we do. But I don't think that is. I don't think that is the actual Alberta model in practice, because they're not doing that, right? That I moderated a symposium on this, and I know that that's not what in practice they're doing. But that philosophy was interesting, saying that there's value in just removing the substance from the person by force. Apparently, I mean, that would be the theory of this, because they didn't want to stop.
But I think yeah.
The likelihood of success is pretty low, but it's possible, right? There could be value.
Yeah, there's definitely gonna be a subset of people where, like, when they run out of funds, they run out of money, they run out of whatever, they don't have access to the drug anymore, that they stop using. There's a subset absolutely like that.
Yeah.
And maybe they develop skills, maybe they develop whatever else.
But expending all the resources to try to cater to those people, the underlying point of everything that we see, certainly in the markets, in where I work, is that we don't have enough access for the people that are dying to literally. Dying is the wrong word, but maybe it is the right word. Dying to get this care, right? That want to stop, that want to make a change.
Yeah, people that want to stop don't have access to care, and it takes
That's
a very long
time. You got to start with first.
And then when they have funds, then they do a Google search. Places like this seem to come up at the top, and then they end up spending the 40, 50K. I mean, it'd be nice to see what kind of outcomes there were. Like,
it's not just 40, 50K. There's people that spend 150K in 60 days there. $150,000. And we're not just talking about rich people. We're talking about people, grandmothers mortgaging their houses to do this, right?
That's horrible.
And that's
it's sickening. That's why it's like you almost have to imagine that these organizations have the person's best interest in mind, because if they don't, like, what is the world?
Well, that's it, right? So
what is the world?
You're giving. I don't think
preying on the most vulnerable, helping the most vulnerable.
There are people that do that, and that doesn't mean everyone does that. It doesn't mean the industry does that, but I think it's important to call out the people that do that, right? So that we know what the bad players look like. I don't mean specifically by person, but we know that there are bad actors in every industry. Yeah. And I know that might be depressing, but also to know what to look for.
But the thing is, like, I would love that. I would love if there was a way to know what to look for.
Yeah.
The other thing is, though, I noticed over the last 4 or 5 years, historically, there's certain organizations that when you hear about the patient's journey, it feels a bit more archaic in terms of what's being offered. And then what you find out over the last 5-10 years, they're adding a lot of these buzzwords, right? These buzzwords that, like, I'm more familiar with, that I've seen before, that, when I do my fellowship training, or whatever these exams are, stuff that I've seen. And so it's still hard to know what that essence is, of what's being there and what's being offered. And so I just, the people that I have talked to who've taken some facilities that are non-medical historically and added things into it. I mean, I know one I really like is like St. Michael's Homes in Toronto.
Yeah.
Like, historically, no medicine, no nurses, no whatever.
Yep.
And just over, like, just they were the executive, they're very creative in terms of
Robin. Do you know Robin Griller there? He's amazing guy.
Yeah, and so when you have an organization with someone like that behind it,
yes.
And then you watch how it grows, you hear the patient story, you see all of a sudden you're like, this is what it could be.
That is the real deal.
And the thing is, in my head, it's like, if there's someone that I've known for X number of years, like a Robin Griller, I can say with full confidence that this is the place to go.
100%.
Right? But for most of these treatment facilities, I don't have that knowledge or expertise around what's there.
Right. But he doesn't have a place in Muskoka. He doesn't have it's not a log cabin. It's not a,
No, but if you were to do a log cabin, I would just send people
absolutely.
there. Absolutely. Just after seeing that decade,
100%.
2 decades of whatever he's done.
Right.
Because I know he would do it well. And I do think wealthy people get bad care, right? Like, I think that's absolutely it. And and actually,
you can do your due diligence of this, right? You can do.
Oh, so I guess what you're saying is that if I need help with addiction care, there's things I can do so I don't get stuck in a place like this.
Yes.
Great.
So who's
there? That's actually a very important, useful conversation.
Yeah.
Because I didn't know where we were going with this. I was like,
sure, let's do a Google search. You don't just do a Google search of addiction. Do the Google search. Who's running this place? Okay, what's the name of your nurse?
Yeah.
What's the name of your doctor?
Yeah.
Can I have it? I'll just search it.
Yeah.
If you did any of those things, you'd find out, but the nurse that you have, she's not licensed as a nurse, and she's actually, if you do a search on the government website, she's on the warning list of people that have been a fake nurse. Literally, you search her name, it's still there, Christine as Dahmer, her name comes up as if you see this person, report it to us.
You know what's funny? I mean, every now and then I'll look up Google search for like different addiction treatments. So sometimes you'll have someone who uses a drug or has a behavior that you don't have access to. And once I looked one up, I said I read the paragraphs what they offer, but I didn't go into the details. They said, okay, look, we've got this and this that you're doing. Why don't you just give this number a call and see what it's like? And the amount of phone calls and emails that this guy got, I had to apologize because he thought they were coming from me, right? And I was like, look, I'm really sorry that it seemed like the principles they were offering were there. I didn't have another place that I could send you for outpatient support. The amounts that they were charging are not stuff that I would feel comfortable having you pay for what they're offering, and I'm sorry I sent you that link, right? For it. And so it's one of those things where it's hard to know what people are getting from where and how to get that certificate of authority and stuff.
Just Google search the clinical director and it says lost license for sleeping with patients. That's it. Not because of the Toronto Star. That's been there for years.
Oh, so when you go to the website, does it have the name of the director on it?
It doesn't. I don't know if it. I don't think it has.
The point is, if it because
you have to ask.
If I had a director that, I would not put their name on the. I mean, hopefully you wouldn't have them
they're slippery about it. Of course, they're slick about it. But if you're going to spend $150,000 to send your kid there, can I get the name of the 3 people that'll be giving them care?
There we go. Good.
Isn't that a fair thing to ask? I mean, that's not a deep due diligence, but it's a little bit, right? It's a lot of money. You would think, I mean, if you're going to buy a car, you'd do a little bit more research, right?
I think you got to sometimes tell me where you're going with these things. Because if I knew your goal was, how do I help you as an individual
to make sure this doesn't happen to you?
You don't get screwed for $150,000. You don't put a second mortgage on your home for it.
Right.
And you get upset at your loved one when they're not better after 30 days.
Right. And you and I, we're talking about places like St. Michael's Homes that we talked about, right, as a success story, right? We know that.
In my opinion, yeah.
In my opinion as well. And this is an opinion that just because of personality, we know people that have done well there.
No, yeah. We know patients that have done well there.
Period.
I know some of the staff that worked there. Right. I did trainings for them like years ago, right? And like just the experience that they had when the overdose started to come with fentanyl, they had to adapt to figure out how to balance harm reduction and abstinence within the same facility.
And he's mastered
and leveraging like limited resources. But the thing is, some of these other places, I have no idea what they get when they get there.
Right.
And the first time I heard of a recovery coach, I just had to ask all these questions. Well, so what do you mean? Like how does it work? Does he stay with you? Where does he sleep? Does he sleep on the couch? Does he sleep there?
Yeah, I mean, these are all great questions.
How much does he charge? When you go for a family dinner, does he come too? I had no concept of the world. And in the case that I had, just like with your case, I can't remember if it was like a week or a month or what it was. Highly effective in that situation, right?
Yeah.
And so, that's why I'm almost hesitant to criticize. Like the stuff in the Star article is stuff that, you wouldn't want anyone to go there.
No, it's indefensible.
If you had a such thing as an enemy, you wouldn't want your enemy to get care there.
No,
right?
you wouldn't.
It's just and then it's uncomfortable. So, okay.
Well, if you had an enemy, you'd want them to get care there.
No, but that's the point. I wouldn't. I wouldn't.
Well,
it's so bad that I wouldn't want them to be there either.
True.
No, that's the metaphor. That's
I get it. Yeah.
So what you've said so far, this is the part that I think is actually, I was like, I knew you always have somewhere good you're going. I just had no idea this time. So what you're saying is that if you're going to a treatment center, find out who the medical director is, executive director, who are the specific staff, who are the nursing staff, who are the physicians, what are their experiences, all that kind of
if it
stuff.
says doctor on site, what's their name? Right? I mean, that's a simple thing. And then you search, this doctor, but your doctor doesn't seem licensed in this province. And then, then now what? Right? I mean, it's pretty, but I think I don't know what would possess someone to do so little research into this to find things out. But other than the desperation, right? And
the desperation.
And
absolutely.
I think the message, though, that I would like people to leave with is, I know there are no good studies on this, but from people that have done this, as this is what we do for a living for a decade, for both of us now, at least, we don't know for a fact that spending money helps you one bit. Is that fair?
I've believed that for a while, and it's hard for me to say it. And my lens is really from working in the different hospital settings that we've been at, and the few people I've talked to where they're paying for that treatment immediately. It's hard to. It's hard sometimes to align things for it, to say that,
I've seen no evidence of I've worked with people that have spent $500,000 and more on their recovery.
Oh my goodness.
And I have seen no evidence that those folks are any better off than the people that have spent zero, right? And I've seen success.
So it's not worse. It's not worse.
I don't have any evidence that it's worse other than the fact that you're broke too.
Yeah, you're broke too, yeah.
Or your family's broke, or, I mean, those are the heartbreaking things. Well, often that is a family member story. And as we know, and as we've talked about before, and when we talk about families, that it's often a lot harder on the family than it is on the substance user, right? It's, often, parallel to, Alzheimer's and things like that. They say that it's often harder on the caregiver than it is on the patient, because they seem to go through life sometimes. I can't speak to the Alzheimer's thing, but I can speak to the recovery thing. And they can go through life. We can go through life in recovery, sometimes oblivious to the danger and the destruction we've done to ourselves, but the family members see it in crystal clarity, right? Because they're sober. There's nothing that's impacting their vision of it. And we have a lot of family members sometimes, sadly, that end up passing away before the patient that they're caring about, right? I can think of multiple cases where, parents have passed away before the kid that they have been trying to get sober for so many years, right? And it's only the time when the parent passes that is just this awakening for the child.
Interesting.
Where it's just like, again, this is not evidence-based. It's just an observation. But it's real.
Yeah, I mean, I've had some people that have had good experience in treatment centers. I don't know, but yeah, I guess
Well, I'm not saying there isn't good.
Got you. But it's really around but it is a predatory thing. I think there's a lot of things.
Players in every field, right? There are, and I think to think that you got to ask your questions, you got to do your due diligence and stuff, right? I mean, spend as much time as you would buying a car as you would finding a care provider to make sure it's a good fit for you, especially if you're, paying out of pocket for this, right? So that's the message that I have for folks to take away.
Yeah, I really like those few specific tips around who are the medical directors, the nurses, the staff that's there.
Yeah.
Give a chance to look them up. Just make sure that they're accredited in some way. I don't know how to check out on nurses, but I do know about physicians. You can check the CPSO website. And
I'll link the link for the nurses as well. There's a link. There's a link. It's just as easy as the CPSO to check whether it's CPSO for physicians, right? If you were unlicensed, you would find it there.
Yeah, and it's hard to know people's specialty training, and everybody has a different philosophy. Even like every psychiatrist has a slightly different approach.
I get it, but if you lost your license, it would be there.
It would be there, yeah.
And if the place isn't willing to give you the names of those people, well, isn't that kind of suspect?
Yeah,
wouldn't it be? Wouldn't that be a red flag?
Yes, yeah.
Yeah, so
absolutely,
trying to get you to commit to this a little bit here.
Yeah. Well, it's tough when we have examples where it just everything seems wrong. It's
right.
just
in hindsight, it's easy to sort of second guess this, and there's still people paying money to go to this place today, and places that are. I don't think regulation would have probably avoided all this. I think nursing homes are regulated, and there's all kinds of stuff.
Yeah, because that's what I was going to talk about, the predatory practices. Like even with nursing homes, it's this may not be true, but they find out how much you have, and then most of it goes away. Right? If you think about if you're trying to have a kid, right? If you're trying to have a kid and you're not able to have a kid, the amount that these fertility clinics charge is astronomical, right? Like it's so much money for that.
Seems like a pattern of you shitting on the whole kind of medical community here.
But there's so many examples of this, right? Like, I mean, I think for cancer stuff, I think like there's certain things, but if you want to get a new experimental treatment to extend, who knows, like the cost of that is also astronomical, right? Yeah. I don't know. There's just, it just seems like anytime there's any industry, there's going to be a subgroup that are taking advantage.
There are predatory players from convenience store operators,
and then there's also going to be people that are going to want to pay extra to get that quicker service and care, right?
Right.
And so I don't know how you would.
I don't think recovery is something that you can rush. I mean, I guess there are. There are treatments offered that profess to do that with varying results, where people are flying away to Mexico and getting different treatments. What was that treatment that opiate treatment that is highly not recommended?
Yeah, no, I mean, I think a lot of people do go for ibogaine or ayahuasca down there.
Yeah,
and I think that'd be an interesting thing to talk about. It's tricky because we're not, a lot of these things we're not fully in that industry or that component.
No, we're not in it at all
of the thing, and so
But we're in the industry of helping the people that
would use those services.
That are tempted to use those services, right? And, so I think we can speak to what we know about them.
Yeah, and I mean, I also have a suspicion I see the ones where it goes wrong. I don't see these success stories for it, so.
Maybe, or maybe I would think these centers are pretty good at advertising their success stories. Wouldn't
Interesting.
you?
Yes, maybe that would be.
I mean, if they seem shameless in every other way, so I don't see why they wouldn't. If they had great success stories, you think they would be putting them front and center. I would think.
Yeah,
I would think in their response to these media reports, they would share some of their success stories. Wouldn't you? What would stop them? Ethics?
I'm not sure. I'm not even sure how many success stories are there.
I think that's the point, right? I don't think they're
like, well, what percentage would it be?
Well, we don't know.
But I mean, for patients that do go through the stuff, and you see them later, you'll like, if you can stay for the 14, 21, 35 days, I think that's a success, because you have that much time away from the drug itself.
If that's the case, if you've got that much time away from the drug itself,
then you have an idea what's in your skin, but you'd almost prefer if they were getting the proper medical care during that time too, whatever that might be.
Yeah, I think obviously you would prefer that. You would prefer to, work on your whole self by then. All right. Was there anything else you wanted to discuss about this?
No, I just I hope more things come to light in terms of what's going on in the industry, what these different places are, what they offer, what they do.
Yep.
I hope eventually things can get tracked around this stuff that's there, and I hope it comes to light. One thing that just came to mind as you were chatting, and this is not really a summary because I think you summarized the key points really nicely. If you're thinking of a treatment facility for yourself or for a loved one, you could obviously Google search, but whatever comes up, you would call them, find who the director was, their medical people, their staff, look them up online, find out what their service is like, find out what a typical day is like. If they're certain therapies or assessments that maybe figure out all the cost up front. Like I just really like to know all the costs up front in terms of the cost of everything, whether to seek it out or not. And maybe try some of the government funded services as well. Maybe that's the one thing that I would add. And in Ontario, I think there are some very good government funded services.
Mm-hmm.
And because of the limited beds, you almost have to sign up, send the application, and you wait a while. But with substance use, we know that it's chronic, right? It's wax wane, remitting, relapsing, whatever those terms are. It comes and goes, right? And then if your life is better in the 6 months or a year of waiting, great, decline it when the time comes up. But if the patterns are still there, might as well just sort of go and try it out and see what you can get out of it then. Some of these private places have publicly funded beds, and they have a certain percentage that are allowed for that too.
Yeah. One of the limitations with that is we have a bit of a bottleneck in our detox system because you've got to go through a detox first. Sometimes those treatment centers will help. They have some back doors.
Yeah, they have some detox, some of them.
Well, not the government-funded ones don't.
Sorry, the government-funded ones don't detox the people there?
They do not, no. No. They do if you pay, but they don't have a detox program internally.
How do you put someone through treatment without detoxing them?
You have it's
and then what if they're on benzos, right? Because benzos take forever to do.
They go to detox, but they don't offer the detox unless you're paying. You still have to go to a detox. I'm not suggesting
these are government-funded beds.
Government-funded treatment beds, yes.
And then they'll only take you for detox if you pay extra?
No, they don't offer detox. It's not part of their service. Treatment is not detox. The look of bewilderment on your face means I'm going to have to do some research on this. But as someone who sends
people, I'm going to have to do some research on this.
Sounds like both of us might. But yes, you need to go to they're not.
But most of the detoxes in the province are non-medical. They're like maybe medically enhanced now. They'll have a nurse one day a week or a nurse practitioner 1 day a week or like
treatment's completely non-medical. So they
don't have any ability to.
No, they have nothing.
They should have some medical person.
And detox didn't have anything until very, very recently. So there's medical detox, regular detox, and
how can you treat someone who's drinking heavy alcohol without detoxing them?
You're misunderstanding. It's mandatory. They will not take people without going to detox. You have to find
another place to get your detox done,
which is detox. The detoxes. You have to go through a detox.
You almost need a coach to walk someone through each of the steps.
Yeah.
And I might have said this here, but I say this in private conversations regularly. There's not a single place that if somebody called me and said, go here, they'll take care of you. And I wish there was. If somebody was struggling, I could have said, just go here and they'll take care of you.
Muskoka Recovery offers detox. They do. They have a detox.
No, and so
these private places do. You can detox there. They pick you up at the airport. You can be intoxicated when you get there. The private places do. They do.
So they probably have some medical support then, right? Like they must. Like we don't know.
Well, we've got Dr. Abu Shahal.
So the last thing I was going to say, because like an idea came in my mind a little bit around this, and there's this guy, Clayton Christensen. He talks a lot about disruptive innovation, and what he thinks you need for the healthcare system for disruptive innovation is three things. So one is that for straightforward things, you need to streamline it, right? So like basic things like alcohol withdrawal or whatever, or depression, you need to streamline it. For things that are complex, you need like experts to really figure out how to handle that N of one where it's complicated, there's a lot going on. So you still need the specialist, but you should have a general stream for that. But the third thing is something that we're absolutely missing in healthcare. And what that is that's a group of people that have struggled with the illness that are able to share their experiences, what worked, what didn't, what was helpful, what's not, the full spectrum of things. And we're working towards it, right? Because a lot of these tables will have people who lived experience there, all this stuff. Unfortunately, the stuff that I see really feels like, I don't want to say tokenism, but it feels like tokenism. But if there's a way to really crowdsource the helpful and not the well, because even when I think about my own work, right, like a certain percentage of people really probably don't like me, and I'm doing my best. I'm trying to help, but sometimes you'll have a different opinion than the person you're seeing. But if you get like 1,000, 2,000, 5,000 patients, right? People that have been through, and their family members maybe, hear about the pros and cons, you'll find the signal of truth. You'll find what really, really works. And you can almost design a program that way. And if we hear from all the success stories from this recovery place, all the ones where it sort of failed, and we do that for all the centers, you could come up with what is that ideal center. Sure. And you just need someone who's almost so focused on the right way to do things that profits and income don't matter, to be the one who tabulates all that data.
Well, that's the problem. The problem is the profits do matter to various players along the way, and that gets into the way. That religion gets into the way because a lot of these centers have religious backgrounds. A lot of issues with these things, but. The most important takeaway from what you just said is I've worked in a professional capacity with you in one field or another for 8 years, and I've never met anyone that doesn't like you.
Well, thank you. Thank you. It doesn't feel that way, but thank you. I appreciate that. Yeah. That's very, very nice, you know.
And maybe that's a good note to
okay, let's go. Next. So thank you. Next.
Thanks, guys.
That was an Ariana Grande reference or song. Thank you. Next.